right, I'm recording. We're going live and letting everybody in.
Hi, everyone. It sounds like you can hear me because people wave when I said hi. Cool. Sorry, we're a little bit behind schedule here. But let's dive in. So just a few updates here. 170 cases confirmed in New Haven. And also through our surveillance system, we're told that there are 4 fatalities total. We're confirming that information and cross-referencing this information with death certificates. We have a total of 7 firefighters that have tested positive and 2 police officers that have tested positive. We also had another 5 or 6 new medical reserve corps individuals that were sworn in today, which is exciting. As we've talked about before, we're moving more people into that are experiencing homelessness into hotels. And by the end of today, we're estimating that a total of 139 individuals will be in hotels. We're working on getting more into hotels, and this is sort of the first phase, but we moved a lot of folks today, and just wanted to thank New Haven Public Schools for helping on the transportation side to get a lot of the individuals from where they were to the hotels. A couple other quick things. I think it's really important to note that the CDC has changed who they consider exposed, and this underscores just how much, how important it is for people to practice social distancing. So previously, the CDC considered someone exposed if they were in close contact with someone who had started exhibiting symptoms. Now the CDC is giving new guidance. You are considered exposed if you've been in close contact with someone 48 hours prior to their symptom onset. And that's because there's a lot of indication that the virus spreads even before people are symptomatic. So that's just another reason why, even if people don't have symptoms, they shouldn't be interacting with each other, and we should be practicing social distancing as much as possible. Just 2 other quick things. We've gotten a number of complaints about grocery stores and people practicing social distancing within grocery stores. We'll be working to reach out to grocery stores and make sure that they are limiting the number of people that are going inside at any one time, limiting the distance between, or making sure people that are online and in line waiting to get into the stores and in line within the stores for the registers are 6 feet apart. But we also wanted to remind folks that are out there to make sure that when they are in grocery stores, they need to practice that social distancing themselves. And we've got a couple of holidays coming up. We've got Easter and Passover, and it's so vital for people to keep practicing social distancing. It's tempting to want to get together with family members and extended family members, and this is unfortunately not the time to do that. So we want to make absolutely sure that people remember that even if their brother lives next door, you should not be interacting with people that are not within your core family right now in order to protect everyone in the community. Those are the updates I had. I don't know if Director Bond or Mr. Pinto, you have anything to add?
Yes, I would like to add to what you just reported. In regards to the 170 cases, some of the things that we do at the health department is also closely monitor some of the details of those cases. And so I want to share a few things as an update. As you know, we have made a commitment to daily provide the community with essential information that can allow individuals to be well informed so that you can make the proper and take the proper precautions. And so one of the things that we are noticing is that when we're talking about who this is affecting, it's very critical for people to understand that while this is a higher mortality for people that are elderly, this is a community-wide transmission and can affect all of us. And so as we delve into our data, what we are seeing is that 42% of our cases currently are 20 people that are 25 to 49 years old. And we want to express with everyone that while there's a mortality rate higher for elderly and those with medically underlying conditions, that this is affecting everyone across the board. And in addition to that, it's really important as we are making recommendations that people really adhere to them and ensure that they are following proper precaution. Please practice social responsibility. If we all just make one effort, we can all work towards flattening the curve together. So I want to thank everyone and commend those entities that have taken extra precautions. I often visit different establishments. It's just to see some practices, and I sometimes even give you a shout out on Twitter for practicing proper precautions. So I want to thank those businesses that really are taking those necessary steps to doing that. And those are my updates at this time.
Ms. Pinto, do you have anything to add, or are you good to go?
Yeah, just a real quick, just a meals update numbers. We did 2,300 today, and we're 16,452 for the week, which is obviously the first week of April here, and then we're so far as 72,088 for the total meals produced and distributed. And I just also wanted to as the mayor said, we couldn't have done the transport on assistance today without the partnership with First Student. That First Student does our daily bus transportation for the students while they're in school, but they have stepped up as a terrific partner in anytime we've asked them for assistance or for brainstorming how we can with kids not in school how they could be helpful, and they were critical in helping to move the decompress the homeless shelter that we were working on today. So I want to just let everyone know that they were a great partner, and I thank them for their help on that.
Thank you. Any questions from folks? Well, let's go with Mary O'Leary.
Hi, Mary. Maybe some details on the, unfortunately, that there's 3 deaths now. I mean, it's the increase of, there was only 1. Any details you can tell us generally?
Sure, I defer to Director Bond. I would say that because we got, last time, if you recall, there were 2 deaths, and then one of those deaths was reported erroneously to us. We are now making sure that we confirm with a death certificate before absolutely confirming the deaths. The State Department of Health has notified us that there are 4 deaths total, but we want to make absolutely sure so that we're not misreporting. So what we're saying is that the state has told us that there are 4 deaths, but we're confirming that now. I don't know, Director Bond, if you want to add anything to that.
And in addition to that, the 3 additional deaths that have been reported today that we will be cross-referencing are elderly individuals.
So that would make it 5?
That would make it 4.
4. Okay. The last time when the information was incorrect, did that also come from the State Department of Health?
It did.
Okay. All right. I just had another question. The movement out of the shelter, was that just one shelter? And can you tell us which shelter was emptied? Or
Columbus House.
Oh, it was Columbus House. Okay. All right. I mean, I was told that New Haven has people in 2 hotels. Is that still the case, or do they have any more hotels open?
There are people in 2 hotels.
And are you still looking to sign any additional contracts, or are all the contracts in place now for hotels?
The state is working on identifying more rooms, and it's possible that there will be an additional hotel.
Okay. I mean, my understanding, just tell me if this is wrong, but the state people said that the state and the city were supporting the hotels that were already filled.
Correct.
That included 2 hotels. I'm not sure if they're totally separate, one's New Haven, one's the state, or if it's a combination of both.
So it's a combination of both. So there's 2 hotels currently, and the new individuals have gone into one of those hotels.
Okay.
So
And
they've added rooms.
okay, sometimes you break up on my computer, but potentially another hotel.
Possibly, yes.
Okay, and that,
It's a lot of people.
yeah, I know. And is the state's picking up? I mean, I know the city had already contracted for a smaller number, but is the state going to pick up the rest of the charges or the cost of this?
I need to confirm with them that. I believe that's been part of the conversation.
Thank
Because
you.
the state's doing that for other municipalities too, is my understanding.
So might there be more people moved over the weekend? I don't know. Is this ongoing?
That's our goal, is to get people into hotels as fast as possible.
And well, maybe how many hotel beds you have contracted and how many more can move quickly?
The number I have right now is that they're anticipating 139 individuals by the end of the day. I'm unclear how many rooms that is. I know that we had 48 before, and 84 individuals before. So that number of 84 is going up to 139.
All right. Do you have extra room to move more people over the weekend in the count? I mean,
They're working on that now. There's a need. They're just finalizing the details on the hotels.
thank you.
Yep. Let's see, other questions. I see Michael Bingham raised his hand.
Good afternoon. With regard to grocery stores and supermarkets, what is the city's sort of enforcement leverage for stores that don't adhere to the guidelines regarding social distancing and number of people in the stores, et cetera? How can you compel them to do that?
So go ahead.
No, go ahead. You want me to take it on?
Yeah, go for it.
So as the health official for the city, we regulate all several food establishments. They're among one of them. And so there's several avenues that we can go about it. Obviously, closure is not what we want to do. However, we do intervention. So for example, we have a sanitarian will follow up and ensure that there's protocols in place. And so we are asking grocery stores to just please follow the recommendations that are and adhere to them so that we can safeguard the community that are shopping at their grocery stores. And so it's really important that they are also incorporating and safeguarding their customers.
And how would you find out if a store isn't adhering to the guidelines? Would that be a customer complaint, or you're doing inspections?
So we're doing a number of things. The first and foremost, people file complaints every day on a number of establishments. When a complaint comes in, we have to investigate them and take them seriously. A lot of community people, they watch our press conferences every day. And so they will take a screenshot of a Facebook picture or an Instagram post and report it that way as well. And so we take all complaints in, whether they're anonymous or disclosed, and then follow up with right now we're making phone calls. A few weeks ago, we did visit a particular supermarket in the city. So depending on the severity of the complaint, we will follow up as needed. So it's really essential that the individuals that see something, say something. And so please report those complaints to us so that we can make sure that we work together on making sure that individuals are being socially responsible, and that goes for businesses as well.
Thank you.
I saw Tom Green's hand up, and then I'll go to Kyle.
Thank you very much, and thank you as always for doing these and fielding questions.
Sure.
Which grocery stores have you received the most complaints about?
So
and which are the worst offenders?
If you asked me 2 weeks ago, I would have told you the answer to that, but my corporation counsel is advising me not to say negative things about establishments.
Okay. You mentioned earlier in the week that I believe there were 3 Bella Vista residents who were hospitalized and had tested positive for COVID. Do you have any updates on how many people at Bella Vista have tested positive, whether there's anyone currently at that senior complex who is positive, or just any Bella Vista updates you might have.
Director Bond?
We reported one hospitalized positive case. And since then, we've had several convenings with Bella Vista, and they have revised their protocols. They have increased their security measures and restriction of visitors. We also partnered with the local community health center that was already on site, Fairhaven Community Health Center, who are expanding their clinical services for that community. So Bella Vista has been complying and are very responsive to the needs of that community.
Director Bond, we had, I believe it was yesterday, reported 3 individuals that had tested positive at Bella Vista. We can double check that information, but I do remember that coming up, so we can double check and make sure.
I apologize about that. I don't know if there were 3 inpatients, so one was certainly an inpatient that we were tracking.
So my understanding, and let's confirm offline and then we can let folks know, but my understanding is that there were 3 positive tests, all were at the hospital.
Okay, well, if you could, I guess we can ask tomorrow or follow up on that. But
Absolutely. If the mayor was able to get updated information on that, so that's good.
thank you. Mayor, last night the Board of Alders approved the indemnification order, at least allowing you to enter into agreements with indemnification clauses. Do you have any updates on the city's proposed agreement with UNH about housing first responders and about any other potential partners where the city might use this indemnification agreement?
A little bit. So we will be moving folks in quite quickly to UNH. So that was basically the final impediment there. I can't give you details on numbers of people or anything like that at this point, but we're deeply appreciative of the Board of Alders for setting up that hearing so quickly and the vote so quickly so that we could make sure to move this forward. We do have one public safety firefighter that is on Yale University's campus who's tested positive for COVID-19, and the university's been kind enough to allow this person to stay there away from their families so that they do not infect their family. We're grateful to the university for opening up that space for this individual.
And my last question is, I heard that the latest relief package approved by Congress and signed by the President, the CARES Act, included additional money for CDBG the city might receive. I'm not sure if that's true. I don't know if you can confirm that. And if so, do you have a sense of how much and how that might be?
That is accurate. We were in a meeting. I was in a meeting with my budget officer about an hour and a half ago discussing this. And there's some limitations on the funding, but it is specific to provide support for municipalities to respond to COVID-19. The CDC is given kind of the HUD is given an initial 1-pager outline of what funds can be used for. And we will be assessing what may be appropriate based on our needs and allowable expenses as to how we might suggest that we use the money.
And is that money currently available, or do you have a sense of when the city might get that?
I'm not sure. I'm not sure. That was honestly one of the questions that came up in our conversation that we're looking into. And I think that, on top of this, as folks know, there's a lot of impacts to our current fiscal year and next fiscal year as well. Some of them that are known and some of them that are a little bit more complicated. We're seeing that our tax collection is down some. This time of year, we typically get a lot of revenue from people that are delinquent on their taxes. And we are not able to collect as much revenue because for 2 reasons. Number one, we're only accepting currently online payments. And number 2, we typically will reach out to people and use a variety of different means to collect taxes that we currently cannot do. Our building permit revenue is likely to significantly decrease, and our parking ticket and meter revenue is basically bottomed out. And so there's a lot of unforeseen or impacts to our budget that we did not foresee. So our budget office is working hard to analyze the impacts and determine ways that we might be able to adjust in the next several months before the end of the fiscal year.
Thank you again. That's it from me.
Yep. I saw Kyle's hand up.
Yes, thank you very much. I had a follow-up question on the grocery stores and then one first responder question. For the grocery stores, I know that there were probably, I think, 6 or 7 items included in that executive order. Are you focusing on enforcing the occupancy, or are you going to look at all of the items in the store? Because we were just back here having a conversation about how do people go about enforcing what happens inside the store?
I think it's tricky. You know, the idea, and Director Bond can add in as well. It very much depends on the store too. One of the challenging things for stores is the physical space for employees. You know, if someone typically operates a small bodega with individuals behind a counter making sandwiches, it's difficult to keep people 6 feet apart. I know that stores are trying to find creative ways to do that. I've seen examples of stores putting indicators on the ground to make sure that people are lining up 6 feet apart. I've heard that Stop and Shop has arrows in the aisles to direct people to only go a certain direction. We would like to work with stores to make sure that they are doing everything that they can to keep people apart. You know, we don't want to take a heavy-handed approach to this and push stores in a certain direction and fine and things like that. We want to partner with stores to make sure that they're keeping people safe. I don't know, Director Vaughn, if you want to add anything to that.
And just to add, to be proactive, we are doing a robocall to the grocery stores with the recommendations. So we really are trying to follow proactive steps to ensure that they're implementing and revising their protocols.
Okay. Thank you. And the second question was for the fire department and also perhaps the police department. I know maybe last week, it's all running together. We talked about staffing in the event that more first responders do become infected with COVID-19. Just an update on that, or how is the staffing going as far as covering the firefighters that are now 7 that have tested positive?
So in general, this is a concern of all of ours as this situation starts to ramp up. And one of the reasons why we feel it's very important to have partnerships such as UNH is also to allow us to separate firefighters from the potential exposure that they may have, say, with their family. If we really need to, if we're starting to struggle with the number of people in the force, we'd like to provide opportunities for firefighters not to be exposed in other ways. Currently, we are managing. The police department has been a little bit more of a challenge. We have, I think, 37 officers out today because of various different either individuals that are symptomatic or individuals that have been exposed. The other thing that will help us is once we get testing to be much more rapid, it'll be easier for us to identify when firefighters and police officers are infected or are not, so that individuals can get back on the job as soon as possible.
So the 37 officers that are out, is that typical, or has the department seen a higher call out rate?
No, that's 37 is the number of officers that are out specifically because they are either symptomatic or more likely, more of them have been exposed.
Okay.
And so we need to have them off the job until we determine whether or not they were actually exposed and actually contracted COVID-19.
Okay.
So that is absolutely atypical.
Okay. And they're waiting testing?
I believe, Director Bond, you're shaking your head. Do you have more answers to that than I do?
It's a combination. So individuals could be asymptomatic and they're just following just precaution to make sure that they remain asymptomatic. And so there's medium risk and high risk categories of individuals. And so it's a combination of the two.
Okay. That's it for me.
See, thank you. I see Mackenzie's hand is raised.
Thanks so much for taking my question, Mayor. Just 2 quick questions on the firefighter being housed on Yale's campus. First, is this kind of a one-off incident, do you expect, or is this a sign of greater collaboration with the university? And second, I know that the UNH dorms are being used to house firefighters who have not tested positive for COVID. Is there a plan going forward to use the dorms that Yale has made available to test or to house those who have tested positive?
So we don't have a concrete plan or agreement with the university yet. I would hope that there is going to be more opportunities for us to collaborate with the university. We're grateful that they were willing to welcome this one individual, that we had an urgent need to find a place for this individual.
All right, thanks so much.
You're welcome. I see Mary O'Leary's hand up again.
Yes. So that one individual, he is testing positive, or he just needs a place to be isolated?
The one individual did test positive.
Okay. Now the number up to, I guess it's up to 7 for firefighters. Let's look at my notes. How many police have tested positive? What are they doing? Where are they staying?
I saw the chief come on and then left, so they're self-isolating. Oh, there he is.
Yes, sir. But apologize. At the end of the day, there's some things we need to clear up before the.
No problem at all.
Yeah. So anytime there's an option for them to self-quarantine or self-isolate in their own domicile, that is preferable. But there are certain times when that is not allowed due to the configuration of their housing or due to the number of people that are in their home. So we're grateful that arrangement. So it's on a case-by-case basis.
Okay, so you're not sure what the 7 are doing? I mean, where they are?
Oh yes, we know where they are. Yeah.
But not because they're definitely positive, they can't use the UNH site, correct?
I'll
Correct.
defer to the mayor. Correct. Yeah.
Correct. The UNH site is not intended for COVID positive individuals.
All right, and you haven't identified a space yet for people who are in that category, if they're positive and they need someplace other than home.
We're working on it.
Okay, and how many more people are, firefighters or police are still in limbo and haven't gotten the test back? They don't know if they're positive
So I
yet.
mentioned the 37 on the police side. I'm not sure if Chief Alston, you want to add?
Yes, sir. There are 5 pending. There are 10 that have been cleared to return to work. And then there are the 7 who tested positive.
Okay, and so the numbers are getting up there now. I know there was some talk of mutual aid helping people out if they need to have other fire departments come in and help. Are you reaching that, or how close is that?
Currently, we have not reached that. In our planning stage, we have certain triggers. One would be to change certain work rules, and then we would negotiate that with the union. That could be scheduling, that could be staffing, but currently we're not there yet. We are looking at 3 different tiers that would trigger how we operate, and currently we're not there.
Okay. Has the testing sped up at the hospital? They were looking at other ways and other places to actually do the test. Has that kicked in at all?
Director Bond, do you know the answer to that?
I'm sorry, well, can you repeat the question, Mary?
Go ahead, Mary.
Go ahead. The hospital had said that they were looking to use the Mayo Clinic to actually vet some of these tests, and they were going to bring in some kind of testing facility themselves. Do you know if any of that has happened? They were going to do it to speed up the process.
I cannot speak for the hospital right now. I know they've been working really hard to increase the response rate and work with their current labs. And so I can probably have a better response for you tomorrow.
Okay. It sounded like the firefighters and cops tests were in the first batch. I'm not sure if that's the case, which was taking a very long time.
Correct.
That is correct. Mm-hmm.
Right.
Any other questions?
I guess maybe any updates on career?
We're almost there.
Okay, thanks.
Other questions? Other questions? I don't think I see any. Matt, one of these days, you're going to have a question. I look forward to that moment. Thanks, everyone. Have a good one. Take care.